Namaste. I am Dr. Shaima Khatri from Faculty of Physiotherapy and Diagnostics. And today in this video, we are going to talk about dermatomes and myotomes. So let's start with the dermatomes and myotomes. The dermatomes and myotomes of the human body with an included dermatome map examining myotomes and dermatomes is a vital part of through neurological examination, particularly when a patient has a spinal cord injury. A dermatome is an area of skin supplied by a single spinal nerve. If we imagine the human body as a map, each dermatome represents the area of skin supplied with sensation by a specific nerve root. It is important to bear in mind that the dermatomes of the head are supplied by branches V1, V2, and V3 of the trigeminal nerve. When assessing sensation, areas close to dermatomal boundaries should be avoided to minimize the risk of misinterpretation. The list is as prescribed is the locations that can be used to assess the dermatomes of the head, upper limb, torso, and lower limb. So the dermatomes of the head are trigeminal nerve, V1, ophthalmic branch, the lateral aspect of the forehead. V2, maxillary branch, supply the cheek. V3, mandibular branch, supply the lower jaw. Avoid the angle of the mandible as it is supplied by C2, C3. C2 is 1 to 2 centimeter lateral to the occipital protuberance. C3, the supraclavicular fossa in the mid-clavicular line. The dermatomes of the upper limbs are C4 over the acromioclavicular joint. C5, the lateral aspect of the lower edge of the deltoid muscle, also known as racemental band. C3, the palmar side of the thumb. C7, the palmar side of the middle finger. C8, the palmar side of the little finger. T1, the medial aspect, antecubital fossa, proximal to the medial epicondyle of the humerus. Dermatomes of the torso. T1, the apex of the axilla. T3, the intersection of the mid-clavicular line and third intercostal space. T4, the intersection of the mid-clavicular line and the fourth intercostal space at the level of the nipples. T5, the intersection of the mid-clavicular line and the fifth intercostal space horizontally located midway between the level of the nipples and level of the xiphoid process. T6, the intersection of the mid-clavicular line and the horizontal level of the xiphoid process. T7, the intersection of the mid-clavicular line and the horizontal level at 1/4 the distance between the level of the xiphoid process and the level of the umbilicus. T8, the intersection of the mid-clavicular line and the horizontal level at 1/2 the distance between the level of the xiphoid process and the level of the umbilicus. T9, the intersection of the mid-clavicular line and the horizontal level at 3/4 of the distance between the level of the xiphoid process and the level of the umbilicus. T10, the intersection of the mid-clavicular line at the horizontal level of the umbilicus. T11, the intersection of the midclavicular line at the horizontal level midway between the level of the umbilicus and inguinal ligament. T12, the intersection of the midclavicular line and midpoint of the inguinal ligament. Now, dermatomes of the lower limbs are as follows. L1, the inguinal region and the very top of the medial thigh. L2, the middle and lateral aspect of the anterior thigh. L3, the middle epicondyle of the femur. L4, the medial malleolus. L5, the dorsum of the foot at the third metatarsophalangeal joint. S1, the lateral aspect of the calcaneus. S2, at the midpoint of the popliteal fossa. S3, at the horizontal gluteal crease, the horizontal crease formed by the inferior aspect of the buttocks and the posterior upper thigh. S4 and 5, the peroneal nerve. Dermatomes. And now it's myotome. A myotome is a group of muscles innervated by single nerve. The myotomes are as follows. C4, shoulder shrugs. C5, shoulder abduction and external rotation, elbow flexion. C6, wrist extension. C7, elbow extension and wrist flexion. C8, thumb extension and finger flexion. T1, finger abduction. L2, hip flexion. L3, knee extension. L4, ankle dorsiflexion. L5, big toe extension. S1, ankle plantar flexion. S4, bladder and rectum motor supply. Plexus, classify into nerves into plexus. Cervical plexus is C1 to C4, brachial plexus C5 to T1, and lumbosacral plexus L2 to S1. As C1 to S4 innervate the diaphragm, shoulder, and neck. C5 to T1 for upper limb, and L2 to S1 for lower extremities. So this is all about dermatomes and myotomes of upper limb and lower limb. Hope you understand it well. If you have any queries related to this video, ask me in comment section. This video is powered by digital version of 2.0, Jyoti Vidyapeeth Women's University. Namaste. Khush rahiye.